Chemotherapy is designed to hunt down and destroy cells that divide rapidly, but because it is systemic, it cannot distinguish between malignant and healthy cells. If a cell replaces itself quickly, the treatment targets it. This makes the human digestive tract a primary target. From the mouth to the large intestine, your gut is a massive zone of rapidly dividing cells. When treatments encounter these tissues, they strip away the lining, causing mouth sores, nausea, and intestinal irritation. This cellular damage triggers a systemic crisis. The injured gut can no longer absorb water or nutrients effectively, leading to rapid fluid loss and dangerous electrolyte crashes. These gastrointestinal side effects represent a major clinical risk. They drain the hydration and strength a patient needs to stay on the treatment schedule required to save their life. In oncology, gut health describes a delicate, interacting system of fluid balance, immune function, and the trillions of organisms living in the large intestine. Chemotherapy and the antibiotics often paired with it act like a bulldozer through the gut microbiome, wiping out the normal diversity of bacteria. Many patients try to rebuild this system by taking generic, over-the-counter probiotic supplements. But in a clinical setting, introducing live bacteria can be a serious mistake. Probiotics contain live microorganisms. As this diagram shows, chemotherapy damages the intestinal lining, creating physical gaps. If you introduce live bacteria, they can cross into the bloodstream and cause life-threatening infections. Emerging research focuses on human milk oligosaccharides, or HMOs. Compounds like 2-fucosylactose reinforce the physical barrier without introducing dangerous live bacteria. Early preclinical studies on medical foods like Humulite, which contains these HMOs and electrolytes, suggest that taking these compounds before chemotherapy reduces diarrhea and protects the structure of the intestine. While these findings in animal models are promising, human trials are still ongoing. There is no instant cure for the gut microbiome during active cancer treatment. Since the gut cannot be completely shielded from chemotherapy, it must be strategically defended against collapse. Hydration requires a hypervigilant approach. Because vomiting and diarrhea deplete sodium and potassium, patients must prioritize approved electrolyte drinks over plain water to maintain their internal balance. When nausea makes standard meals impossible, eating 5 or 6 small snacks throughout the day can sustain the baseline calories needed for recovery. Strict food safety is also a requirement. Since chemotherapy strips away immune defenses, even minor bacteria from unwashed produce or undercooked meat can cause a severe infection. Fiber intake requires precise adjustment. As this scale illustrates, high-fiber foods can worsen active diarrhea. Yet those same foods are often necessary to relieve the constipation caused by anti-nausea medications. Patients must take their prescribed anti-nausea and anti-diarrheal medications exactly on schedule. These drugs work best when they intercept symptoms before they spiral out of control. These tactical interventions preserve the body's structural integrity, preventing the dehydration and infection that would otherwise halt life-saving treatment. Digestive side effects are predictable biological reactions that can be actively and scientifically managed. Because every cancer type and chemotherapy drug varies, there is no single diet or supplement that applies to every person. A patient's most powerful defense is establishing early, open, and continuous communication with their dedicated oncology care team. Attempting to fight cancer naturally by abandoning evidence-based medicine in favor of unproven gut supplements introduces dangerous risks to the treatment plan. Strategic gut support preserves the body's physical strength, ensuring the patient can withstand the treatment so the chemotherapy can save their life.